that was a problem back in when screwworms, if you've ever heard of screwworms, that was a problem because screwworms were fly larvae, a specific species of fly larvae that did feed on live tissue. And that caused major problems in the animals that were infected. But these usually just feed on dead tissue. Now, they could propagate infection. They're not sterile maggots, so they harbor organisms and things like that, which could potentially be a problem. So we're going to get rid of them, flush them out. But they're probably not hurting things in and of themselves. They're probably helping us to get rid of some of this dead tissue. But we're going to help, too, by debriding it and kind of cleaning it off. I want to put sugar on it. I think that's great for it. And I probably put sugar in a bandage. The other thing that it does, too, is it gets sticky, right? I mean, sugar solutions get sticky when they kind of dry, especially when they dry out. And then what ends up happening is it makes the bandage stick to the wound a little bit. And then when you rip the bandage off, the next time you change the bandage, it kind of takes some of that dead tissue and takes it back to the healthy tissue again, because the loose tissue pulls off. The healthy tissue is probably not going to pull off. But there's very few things. Some people use honey too. If you've ever heard about honey, like Manuka honey in wounds and things, it's the same deal. It's that hypertonic sugar nature of it that helps the healing of the wound. So we debrided the wound. We put some topical antiseptic ointment on there, which is Petermycin, and that's kind of this red. It actually looks like jelly. I think we manage it for a day with some sugar as well. And then we put this Penrose drain in, and that basically just keeps the wound open so that fluid doesn't accumulate underneath in blind pockets in there. So basically that just allows for drainage. We did not close the wound. And sometimes this is a thing that owners want us to do, and they see this huge wound and they say, can't you close it surgically? Can't you put sutures in it and close it down? It's a problem when you completely close it. Now we did put some, I will qualify, there are some sutures, and you're like, oh, what are these things? They're sutures. They are sutures. But we didn't close it all the way down. We just pulled it together to put some tension on that skin to help with the contraction process. Because we want this wound to contract down, we want it to get smaller. So we thought, well, if we put a suture from one side to the other and just put some tension on it, that will help with the contraction. And it did. Now, we ended up breaking those sutures out in about a day. But we hope that it would kind of stretch that skin out a little bit so the contracture is easier, right? And that wound shrinks down better. But everything in here that you can see, this red stuff, is actually open wound. The problem with closing it down is it's massively infected, right? It's nasty infected, and if you close down and close that completely off, you're trapping that infection in. And one of the principles with infected areas is you want to get them open. You want to get them open to drain, to dry out, open so we can treat it and put antibiotics and stuff in it. But if you close it down, it's just going to form pus, probably turn into an abscess, things like that. And then ultimately it's going to bust open and you're going to be back to square one. So we want this to drain. In fact, we made another hole for it to drain, and that's where this little rubber drain is going through. So we continued to manage this in day 3. And before we cleaned it up, it looked like that. And then after we cleaned it, it looked like that. It's getting really nice and pretty now. All the maggots are gone. And then here's that Penrose drain still in place. And about day 5, we broke the initial sutures that we put in, like I said. And so we put in some bigger sutures just to kind of pull those edges across. Again, it's not completely closed. There's a big open space right in there. And we debrided it a little bit more. And then we actually sent this bull home. And we said, we think it's going to do well. Take him home. We're not really doing much stuff with him here anymore. And see what he does. And so we gave him instructions to kind of keep an eye on it and then bring him back in a few weeks for us to kind of reevaluate. So he did, and I was surprised that these umbilical tape sutures hadn't completely fallen out, and so we ended up cutting the rest of this out. But this is filled with granulation tissue now. So this is what I'm talking about. So remember this, if you appreciate here, see how deep this is? I mean, this is probably about an inch deep all the way around. And then 3 weeks later, it's contracted down. It's starting to, first of all, it's filled with granulation tissue. It's flush. If you feel across that, it's basically at the same level of the skin all the way across. And not only that, but it's starting to contract down. And notice, I mean, it's about half the distance between here and here is now half the distance at, oh, this is not on case. It turned into a ghost. It's about half the distance between here and here. It's starting to pull together, and that's what these wounds do, and it's really cool, and it will continue to heal. We told them it'll continue to heal. Now there's some scabby stuff on there, which is fine. It's basically just dried blood on the surface of the wound, and we didn't pick that off because it's probably helping to keep that wound moist and to keep things healing underneath. Even though it looks kind of ugly on the top because it makes it rough and bumpy, it's helping it. So, I mean, we could have pulled it off. It wouldn't have been that detrimental, but it's certainly not hurting anything, and in fact, it's helped a little bit. And then we are starting to get a little bit, I mean, we may be about at the end of the contraction. I mean, I think it's still going to contract down a good bit more, but you can see right around this edge, it looks like we are starting to get a little bit of epithelial production. And that may be the start of a little bit of scar formation. And again, not normal skin. The skin itself is not going to regenerate, so it's not going to get hair follicles. It's not going to have the same pigment like normal skin, and it's always going to be more fragile. But hopefully it'll be an epithelial covering that'll be waterproof, and it's not going to be, this granulation tissue won't be exposed anymore. But eventually, it will reach its maximum point of contraction, how much it can contract down, and then it'll form that scar over the top. So, but he's going to do great. I mean, he's going to have a scar there. There's going to be somewhat of a scar at some point in time, but he's going to make it. He's not going to have a chronic infection. He's going to breed cows, which is his job in the long run. So we already talked about that, factors that determine healing. Any questions with that? Any thoughts? Anybody do anything different? So that was a pretty recent case. This case is Bebop. He's a goat, and he's had a long history with us. He originally presented, he's about 1.5 years old now. He's a Nigerian dwarf. And sometimes when I say Nigerian real fast, I say Nigerian, and I'm like, I get all caught up in my words. So the joke on me in the clinic is people call them Nigerian dwarfs because I made that mistake before. But he's a 1.5-year-old Nigerian dwarf goat, and he's had a previous history of stones in his urethra being blocked. And if you guys know anything about goats, male goats, that's one of the most common issues that they have, is they get urinary blockages and obstructions. And so he had a previous history of stones, and he presented to us on emergency here about 2 months ago, maybe 3 months ago, because he couldn't swallow very well. The owners noticed he couldn't swallow. He was dehydrated, he was anorexic, and I guess that's it. So, any thoughts out there? Anything that you're thinking in the way of what may be going on with them, things that you want to do with them, to diagnose, or things you want to treat? What do you think? What's that?
He needs a line for fluid.
Okay, a line for fluids because he can't drink? Like an IV line? Okay, good. So if this is true, and he really had difficulty swallowing, he's probably getting dehydrated, so I think that's an excellent thought. He probably could use an IV catheter and some IV fluids because he can't get the fluid into him orally. Great. Any other thoughts? Yes? Urolithiasis, good, yeah. So he had a previous history of it. We treated it in the hospital. Basically we put a tube in his bladder so he could urinate. So that's the problem with urinary stones, is they can't urinate, and that's a pretty important thing to be able to do. And so we put a tube in his bladder so his bladder drained, and then we dissolved the stones that were in his urethra obstructing him, and then once we got those dissolved, we pulled the tube out of his bladder. And that's the most common way that we manage those here. And we also ended up doing a perineal urethrostomy on him, where we went above the common site where they block, and we opened that up so that he could urinate out through that hole.
Well, I just saw a piece that this summer. Yeah.
Oh yeah?
The Skittles, unfortunately, didn't make it, but it was a very interesting procedure.
Yeah. Yeah, it is an interesting procedure. So that's exactly what we did. That's exactly what we did with him. So, but he seemed to be okay from that. Although, especially with an animal that has had a previous history of stones, you always think about that in the back of your mind. So the first question that, I would want to ask this owner, this wasn't actually my case, but the first thing that I'd want to ask him is he peeing? Because if not, that's an emergency thing that we need to address. And maybe some of these other things that we're seeing are secondary neurologic problems because he's got the urinary blockage, which is quite possible. So that was one of my first thoughts. Great. Any other comments? Yes?
Maybe want an X-ray around this area to see if there's anything blocking the lungs?
Yeah, great question. So we want to take an X-ray or some type of imaging around his neck, throat area to see if there's something blocking and preventing him from being able to swallow. Great thought. Yeah. Yes?
Does he have a temperature? Yeah, and is he swollen at all? Yeah.
Yeah, so does he have a fever and is he swollen at all? I don't know. I forget if he had a fever on presentation. It is likely that he did have a fever on presentation. Yeah, those are excellent thoughts, y'all. And so you guys are thinking like clinicians, which is a really good thing. And even though you may not know exactly what's happening with this goat, these are things that are good, things that we need to do to say, hey, I mean, it's pretty critical. If you can't swallow, we need to do some other things, keep him hydrated. And now we're thinking about things that we can do diagnostically to try to figure out what the problem is. Because they don't come in. No patients ever come in with a big sign on them that says this is my problem and this is how you fix it. So it's our job as veterinarians to be able to run some tests, to kind of use our brains and try to figure out what's going on with these animals. So this is what he looked like, Bebop here, and he's got. What do you think about it? What kind of things that strikes you as being, wow, that's not normal?
Looks lethargic.
Okay, it looks lethargic. I would agree with that. Yes?
Is he neurologic?
Oh, is he neurologic? Yes, he is neurologic. Very good. What makes you think that he's neurologic?
His head's tilted and his tongue.
Excellent. His head's tilted and his tongue's hanging out. And so he's got what we call, fancy here, a head tilt. And he's got an inability to keep his mouth closed, keep his lips closed. Good. Excellent. Anybody want to take a guess as to a disease? Anybody hear of a disease that they know of that may cause goat? It's actually fairly common in goats. It's one of the common neurologic diseases in goats. There's about 3 of them. There's a bunch of them that could occur, but there's 2 big ones that we talk about, and kind of a third one that we talk about oftentimes in there. And maybe with baby goats, we talk about another 4th one. I'm getting down the road. If it's, I'm going to stop now. But it's there's one that's almost very classic, where they have a head tilt and they have facial paralysis because they can't close their mouth yet. Oh, it is the same one where they run around in circles. And they surf. Do you know what it's called? You bet you. It's called listeriosis, and that's what this goat has. This goat's neurologic. He's got a head tilt, It's got a lip group, it's got facial nerve paralysis, unilateral, meaning one side, facial nerve paralysis, and watch him walk. I don't know if Bebop did much circling, but lots of them. And the characteristic, it's also called circling disease because they circle, they wander around. And ruminants are really predisposed to getting listeria, and it's usually a pretty bad disease. Anybody know what causes it? What the disease pathogenesis is? It's caused by a bacteria. And it's basically it is spread. They ingest it, and it's in the environment. Listeria monocytogenes is the organism name, and it's basically they pick it up from their environment in their mouth, and then through little cuts and abrasions in their mouth, it migrates up the nerve from the mouth, goes up the nerve and travels the nerve to the brain. And then once it's in the brain, it causes little micro abscesses, basically tiny little pinpoint infections in the brain stem. And then that causes all these neurologic symptoms. And so when they have it in this disease in the brain, then they start getting other nerve issues and other nerve dysfunctions, and they're neurologic. Excellent. This little wrap around his neck, that's an IV catheter. Someone said we want an IV catheter so we can give him fluids. We've got an IV catheter and we're giving him fluids because he can't drink, because he can't close his mouth, and he can't swallow because the nerves to his face and head are organ. So good. So these are his problems. He is inappetent. He can't eat. He's lethargic. Someone said lethargy. Very good. He's got hypersalivation. So what is that? What do I mean by hypersalivation? Drooling, right? And it's important to understand, what does hyper mean? Increase, excess, right? And salivation means salivating. And it's somewhat of a misnomer, because he's not really salivating more than a normal goat. Goats produce a lot of saliva. Ruminants produce a lot of saliva, way more saliva than you or I produce. Okay, ruminants produce a lot of saliva. Anyways, but what is he doing? Why does it look like he's hypersalivating? He can't swallow, right? So he's drooling. Yeah, he is drooling, but he's really not producing. We call it hypersalivation, but you have to understand that it's probably not. I mean, there's a few things that might cause hypersalivation, but there's more things that cause an inability to swallow, and then they just drool because it falls out. So good, hypersalivation. He's mentally dull, which you could argue, and that kind of goes with the lethargy. He's got an absent palpebral in the right eye. So what does palpebral mean? What does that mean? Yes? Excellent. So you touch their eye and they should blink, right? And so that is, he doesn't have that. He's got a lip droop on the right side. The right side's lip is drooping. He has lack of nasal sensation when you touch his nose or poke his nose with a needle or pinch it. He doesn't feel it on the right side. And he's ataxic, which means what? Pardon me? He's off balance. Yeah, he's off balance. He kind of walks like he's drunk. Excellent. He's ataxic, and he's weak. Okay, he has a hard time kind of getting up, but you get him up, and he kind of walks. Funny that he's not circling on one of the things. Like I said, he didn't present really with that, but wouldn't be surprising if he was circling. I asked what body system's affected. It's already been answered. It's the neurologic system, right? He's a very neurologic animal. So you guys did great, and you got the diagnosis. Listeria. Good. So how do we proceed? So what do you want to do now? I guess I already gave you all those answers up there. So what we did was we did a biochemistry profile. We did a good physical exam. We found all these things. Don't just start with blood work. Okay, so start with a good physical exam. Try to figure out, do the simple things first. And sometimes we get into this thing, especially newer veterinarians, they just get out and they kind of freak out, like deer in the headlights look, and I see it all the time. And I had it when I first graduated too. Sometimes I still do it. And you get this thing, and all you can think of is, wow, I've got this sick animal, and it's like, what do you want to do now? What do you need to do? It's like, I don't know, we need to call a vet. It's like, oh wait, I am the vet. And then you have this, oh no moment. It's like, because I got to come up with an answer, and then you start falling back on things. Well, let's run blood work, and let's do this. And so don't use that as a crutch. But if you know something specific that you want to look for, then it can be a really useful tool, okay? So we ran a biochemistry profile, which assesses the electrolytes and things. Why might we want to run that? And I said especially bicarbonate. So assess the electrolytes, especially bicarbonate, which is one of the electrolytes. Why might we want to run the biochemistry profile? We already have our diagnosis. I mean, you guys diagnosed it, right? Before we even got to this. So why might we want to? We have a good idea what's happening. Okay, it might give us an idea of chronicity and how long this process has been going on. Might there be anything on this that would help us treat this animal? Do you have any reasons to think his electrolytes might be a little bit out of whack? And why? Yes? Good. Okay, good. So since he's not eating or drinking, he's not getting normal replacement for those electrolytes. That's good. That's a great thought. Why did I say bicarbonate specifically? Yes, and so it does affect our pH big time, and so you're right. In the pH of the blood is really critical. And so if the bicarbonate's off, they can be really sick because they get, if the bicarbonate's low, they can get what we call acidotic, and that can make them really sick. And so that you're getting at it. So that would be a thing. But would we have any guess? I mean, you have another animal that's sick too. We may not want to run that. But in this case, we do. Guess what he's yes.
Does it have something to do with like him not being able to close his mouth, like the saliva?
Yes, it does. Like how? Yes. Do you want to take it any further? You are on the right track, 100% on the right track.
I know that bicarbonate acts as like a buffer.
It sure does.
But I'm not sure.
Okay, you're right. You're right on that. So bicarbonate acts as a buffer, and so it modulates the pH, keeps the pH of the bloodstream where it needs to be physiologically. And guess what's in bicarbonate? Or guess what's in saliva? Bicarbonate. Lots of it. Okay? And that's one of the main electrolytes in saliva. And saliva buffers the stomach, right? It buffers the rumen with the bicarbonate. That's the normal process. Well, if they're losing it because he can't swallow, now the overall bicarbonate balance in the blood, that's a tongue twister, the bicarbonate balance in the blood is now low, right? And so now he's going to tend to get acidotic, which can make him more sick. So yes, that's why we want to check this, because we think, since he's been drooling a long time, and it will give us an indication, if it just starts today, he's probably not, or 2 hours ago, he's probably not going to have an abnormal bicarbonate value. But if it happened 2-3 days ago, and he's been drooling excessive amounts since then, he likely is low. He's likely what we call acidotic, because his bicarbonate is excellent job, guys. And so that's 100% correct. So we assess that. And then if it's low, what can we do? Pretty simple. We give him bicarbonate. And if he eats and he could swallow, we can give it to him orally. You just get a box of baking soda, which is sodium bicarbonate, and you can dump it in water and have him drink it. Is that going to be effective here? Absolutely not, because he can't drink. So how can we give it? Yeah, we could give it IV. We could give it IV in the fluids. Instead of just fluids to correct his dehydration, now we can give him fluids to hopefully help restore some of those electrolytes, especially the important ones like bicarbonate. Good, excellent. How can we provide nutrition? He can't eat either. So what are options here? Let me stop. Think about that for a second. I'll give you a clue. ruminate on that for a second. And then, let's talk about antibiotics. So we know he's got listeria, right? We know he's got listeria based on clinical signs. He's read the textbook, except for the circling thing. It's not circling, but whatever. Everything else is textbook for listeria. We're going to treat him with antibiotics. The two big antibiotics for treating listeria, oxytetracycline and penicillin. We elected for penicillin in this case. Okay, end with the antibiotic story. Let's go back to the provide nutrition. So we've got antibiotics, we're hopefully treating the primary disease, but in the process, until he gets better from that, we need to give him some nutrition. So how are we going to get nutrition into him? Yes?
Could you do like a feeding tube?
You could do a feeding tube. That is definitely an option. You could do a feeding tube. In small animals, they do feeding tubes a lot. And that would be, if he was a small animal with a similar kind of analogous disease, yes, that would be exactly what you do. You do a feeding tube, either an esophageal tube or a PEG tube, right into his stomach. The difference between small animals and ruminants is small animals, we can give them pretty adequate stuff to maintain their diet, sort of pretty normal diet, and we can make it all squishy, and we can squirt it in a syringe through a tube. In ruminants, they have a lot of hay and other forages that's important for their rumen to function, and those plug a tube up. But you're on the right track too. And so, is there anything else sort of along that line that you can think of? Maybe it won't fit through a feeding tube, so we need something bigger to get into it. Yes?
Did you do a cannula?
Yes! A cannula. Excellent. So, you guys all met B and Amy, or it's actually not B and Amy because Amy died. B and New Jersey, our New Jersey cow, out in the barn. They've got cannulas in, and that's exactly what we did. So in those, even though those cannulas are for predominantly taking rumen juice out, right? Rumen contents out so we can give them to other animals, it works both ways. If they have a cannula in place, we can put stuff in them to feed them, to provide them nutrition, right? And so that's exactly what we did with him. So we did a rumen cannula. Now this is a baby cannula compared to what our cows have out there, which are big 4-inch cannulas. And this is about a 1.5 inch cannula that we made out of a little pill bottle. But we did the same thing. So on the left side, that's where the rumen lives. We incise down into the abdomen. We pull the rumen up to the body wall, and we suture the rumen to the skin. So we create a seal. So we don't get rumen contents that leak into the abdomen. And then we put a little cannula to keep it open. Dr. Muir here is suturing the cannula into the skin. And that's what it looks like. So Bebop now has a little rumen cannula, and we can feed him. And so it's very similar to the stomach tube, except it's not a tube, it's bigger because we can't get what we need in that, but we can certainly get it in this and put it in there. So that's what he's got. He still has his IV line, that's this little spring tube there. It's a spring so you can walk around the stall and keep them tethered. And anyway, and then he's actually starting to try to eat some hay. He's not getting it very good, but he's trying to eat it, and he can't really swallow it. So we're providing most of his nutrition through his cannula. And so that's him in the back of the stall there with his little IV line. You can see his little rumen cannula right there. So that's Bebop. Bebop actually went home after he was here for this. And then he came back about 3 days ago, and he had he just wasn't doing good with his cannula, but he's eating it, and he's able to drink, he's able to eat. We got the primary issues under control, but now he's starting to have some problems with his cannula. He actually had a few maggots kind of around the cannula, because cannulas they leak, right? And if you ever look at our cows out there, I mean, they have fluid that drips down, some flies got in, they got maggots. And so he was having problems, he's eating now, he doesn't need it. So we actually took it out and we surgically reversed his cannula. So we cut it out and sutured everything back together sterilely. I was hoping to have some pictures of that, but I think there were some pictures taken somewhere, but I didn't have it for this presentation, so I apologize for that. Anyway, that's Bebop. He's doing better. He's still not perfect. We can hopefully get some weight on him here in the next few weeks. See what he does. But any questions with that? Yes. Long-term side effects with a cannula or with listeria? With listeria, yeah, good question. So listeria is one of those diseases where, especially in sheep and goats, cattle seem to have a better prognosis with it. I didn't ask you the prognosis thing for listeria, but in small ruminants, in sheep and goats, sometimes they don't. You can treat them aggressively with antibiotics, and you can do fluids, and you can do everything right, but it's a bad disease. They have basically an infection in their brain, and they just sometimes don't get over it. So you can have anything from, as far as long-term side effects, you can have anything from none, and they're completely normal, to they die. And anything in between to just permanent neurologic deficits or maybe minor neurologic deficits where they partly recover. And I would say that's Bebop's case right now. He's mostly back to normal. He doesn't have a head tilt anymore, and he's not drooling anymore. But he's still not 100%. I don't think he's eating quite like he should. And maybe that's just because he had this rumen cannula in, which was affecting his rumen motility and things, or maybe it was because he's got permanent neurologic deficits, some minor neurologic deficits. I don't know the answer to that, but yes, there definitely can be long-term side effects. Good question.
Does he still have paralysis?
He doesn't seem to still have paralysis. I think he's pretty much over that. His tongue and stuff's not hanging out like the picture, and he doesn't seem to have that head tilt. At least that's super noticeable now. Yes?
Did you ever get your dream truck?
No, I didn't. Thanks for asking. I got a truck, but it wasn't. So growing up, my dad had a Dodge pickups, and this probably wouldn't want to know, but I'm going to tell you anyway. And so I wanted a new Dodge. I was going to get a green or blue, one of those other two, because I wanted that. The Dodge pickup was going to have a Bowie Portavette unit in the back. And none of that turned out. I have now a white F-150. But it's good. I like it. It's at least enough that I can drive around and I can pretend I'm driving my dream truck. All right. Well, thanks, guys. I appreciate it.